Steve Brine.
Thank you, Madam Deputy Speaker. I just want to make 3 brief points, if I may. I have to say I welcome the Prime Minister's statement last night and here today. For me, it's a balanced assessment of risk and us learning to live with risk while exercising our judgment and, as the Prime Minister put it very well, good old-fashioned British common sense about how our actions could impact our society and, yes, the NHS. I have to say I'm saddened by the different emphasis from different parts of the UK overnight. But nations will exit lockdown at different speeds as the infection rate varies, and that's fine. It's called devolution. If we couldn't cope with difference within the United Kingdom, then we shouldn't have gone down the road of devolution in the first place. Having questions and stress testing a political decision is right. That is our job here on the backbenches. Constantly picking for political advantage and having what I suspect is a far worse argument in public than in private is not. Secondly, the help offered. I think there's been a Herculean effort on behalf of this government on the furlough scheme and the self-employed help scheme. On the latter, I welcome it. For over 90% of self-employed workers, it is there as a safety blanket. But for those new to self-employment, I have a constituent who was made redundant less than a year ago, put all of his redundancy money into his new business. He's a wealth creator, he's not eligible. If you're earning over the £50,000 profit limit, not a huge amount of money in many parts of the country, you're not eligible. If you're the director of a limited company, equally, you're not eligible. Now, I understand it's difficult, and as I've said to the Chancellor in this House before, the answer may be inelegant, but there has to be an answer. And HMRC are not adverse to taking back what they think has been wrongly claimed. We need to get help to people now. And on the furlough scheme, I have to say, I think if we're to avoid the cliff edge as it draws to the end of its natural life, in its original form anyway, flexibility has to be the key. So flexibility on the percentage paid perhaps, but only if that goes hand in hand with flexibility around the no work while furloughed rule. And flexibility on sectors too, if the Treasury goes down that route. For instance, a food manufacturer, Madam Deputy Speaker, in my constituency, whose principal customers are classed as hospitality, will be stuck between a rock and a hard place if the furlough scheme were to be withdrawn for manufacturing only. Flexibility must surely see the furlough scheme extended to hospitality and their suppliers in that example. The Prime Minister hinted today on a statement from the Chancellor tomorrow around the furlough scheme, and I will be listening carefully. And finally, the Royal Hampshire County Hospital in my constituency, one of Florence Nightingale's original hospitals. I cannot praise them enough. The leadership under Alex Whitfield and the staff there, many of my constituents who have just gone, as always, above and beyond. We have a weekly call with the acute sector, with primary care, and with the commissioners as well as the DPH for Hampshire of local MPs. They keep us beautifully updated on the work that they're doing. The progress on delayed discharge in my hospital, Madam Deputy Speaker, has been nothing short of remarkable. My trust is down to single figures on its delayed discharge numbers, and that's unheard of. Why? Because we've flattened the division between the decision-making and the money trail within the NHS. We must not, we cannot go back. If it's to be health and social care, we cannot go back. And finally, on cancer, we must remember the people who haven't presented to the NHS during this pause. We do not want to ditch the 75% ambition on cancer in the long-term plan. Thank you very much.